will take questions in the next short while.
Awesome. Thank you so much for that, Rick. Um, the work that you've done is incredible. And thank you for the mentorship and coaching that you've provided to me over the past couple of years also. The persistence and your resilience over the years, having to go through all the things that you had to go through to do this work and show us both sides. I think that's what I really like about your work is that you show all sides. It's not, it's not one-sided. And that's the only way we can move forward in helping humanity move forward from this mental health crisis that we are encountering right now with true unbiased information and scientific information that you are also providing and that kind of a perspective. um, I
Yeah,
have a yeah,
it's important that we keep on examining the mechanisms of action. I think it's quite early in the field, and if we just say it's this kind of experience or that kind of experience, and we don't really need to dig any deeper, I think it might become kind of doctrinaire, rather than a continuing scientific investigation of how psychedelics actually work.
yeah, absolutely. And I've had people who come back and they've gone on a retreat in South America somewhere, and they come back and they say, um, the good ones, they say, don't become a preacher afterwards, because it is the meaning that you're giving it. And in these states, as you mentioned, there's a degree of suggestibility that occurs, and I think that is something that absolutely needs to be explored and talked about very openly, because the guide that you choose to be with and in the environment that you choose to be in, and in your new book, the psychedelic handbook, you very much go into set and setting. You have several different sections talking about set and setting, the environment, the guide, the intention behind going into these states. And that's what you're going to get out of, and the energies that you're exposed to during this vulnerable state is very important too. So being very aware of all of it when an individual is choosing this path is very important. And it's not for everyone.
No, the most important thing is to educate yourself to understand what you're getting into, and to prepare yourself as best as you can for the kind of outcome that you're desiring.
Absolutely.
And it could be for good or it could be for ill. The case in point bring up over and over, much to a lot of people's chagrin, is the case of Charles Manson and the Hells Angels being the major LSD distributors, back in the day in the Bay Area. You can use these for good or for bad, depending on your set and your setting and your
Yeah,
intention.
absolutely. Absolutely. So educate yourself. That's huge. You brought up a great point that I haven't really heard a lot of psychedelic researchers talk about, is the adverse effects, and that there is what you saw in your research was about a 10% rate of adverse reactions or
Mhm.
effects. Um, You also mentioned earlier that there seems to be a decrease in chances of having an adverse effect if one is uh, has screening, supervision, and follow up. I call it, having life practices before, and a guide before psychotherapy, before a guide during, maybe the same person who is preparing you for it and is talking about your previous traumas that may come up during the session to prepare you. Hey, how do I deal with this? How do I do breath work? How do I instill these life practices in my life before the session? And then in the session, I'm with trusted guide or guides. Oftentimes what we're seeing in research is two therapists that sit, and then intensive psychotherapy afterwards. Do you see any studies that really mention that? Because majority of the studies that I've looked at from, I want to say 2010 and on, have talked about that. They do glorify the experience itself, but they all have mentioned the pre, during, and post work being very essential.
Yeah, well, usually that material is included in the methods, section of the paper, and it's pretty small.
Mhm.
The they discuss the certain number of hours of preparatory psychotherapy education about what to expect. But it isn't really emphasized. It's not really spelled out that much. I think it'd be quite helpful if some of these research groups actually publish their manuals to help us understand what are they actually telling their subjects, and what do they do during the sessions, and what's their model of integrating the experiences. If, for example, your team believes that mystical experiences are key, the education, the preparation will be, there are these things called mystical experiences which have been reported throughout the ages. They're the foundation of all the major world religions, and they help and they heal. And this is the kind of music we're going to play to induce that state. These are the kind of directions we'll give you, and the suggestions of dealing with acute effects in order to attain that state. Once this experience is over, the experiences are integrated and understood and interpreted within the mystical experience model. Um, so that's one approach. The other approach is motivational interviewing, CBT, DBT, psychoanalytic approaches. So when a group will write in their methods section of the paper, supportive, open-ended support was provided. I mean, that's just not that useful.
Yeah.
And I think if it were unpacked, it would go a long way to either describing successes or failures with respect, to the kind of studies going on.
Yeah, absolutely. And that's one of my interests in research is looking at conscious life practices like meditation, like hydration, like eating good nutrition, exercise. There's 12 of them that I've developed over the past 6 years, looking at those by themselves and then those with psychedelic medicines or even microdosing and macrodosing and that kind of a research and talking about, hey, what kind of meditation, what kind of exercise, how intense, right? I think these would be very telling in helping our physiology and neurobiology to optimize, and as well as guiding the person, as with psychotherapy, with what comes up before their session. um but yeah, you're right. In all the papers that I've read, from Yale to Hopkins to Stanford at UCSD, no one really talks about and goes into what spiritual support they have provided. They just talk about support was provided. So that would be great to define. Yeah.
Yeah, and the spirituality, I mean, spirituality, comes in a lot of different flavors and reflects a particular worldview, a particular theology, a particular set of beliefs about our relationship to the spiritual world. Either it's inside of us or outside of us. It's like God, or it's God's, or it's nature. It's all one, or it's all different. So just spiritual experience itself can be open to a lot of different interpretations and uh, manipulation. For example, if you don't believe in God, but it's a God-oriented session, you're not going to really have that much fun.
Absolutely. And that's what's really important. Again, you're in a vulnerable state. And so whatever is being imparted upon you, it's likely you're going to take that with you also. Um, Let me see what else, what other questions. Oh, you mentioned the role of, and maybe this will be the last question, um, the role of DMT and schizophrenia. Do we know more about that? There's a hypothesis, that actually you had mentioned in one of your interviews, talking about um, patients with schizophrenia might have more receptors, or that endogenously they have more DMT
Hmm.
running around. And so these individuals, all the studies I've looked at, they have been excluded from all the studies. So schizophrenia, bipolar, and any psychotic or manic episodes that a patient has had in the past, they get excluded from the study.
Yeah. Well, you're talking about two different
Yes.
questions. One is what is the role of endogenous DMT in psychosis? And once um, DMT was discovered in human body fluids, everybody was interested in, is there abnormal secretion or production of DMT in schizophrenics? And those studies never really got off the ground because of the assay questions. The concentrations of DMT in blood are very, very low, and they're extremely hard to measure accurately. Um, so by the time the sophistication of the assays got up to scratch, the compounds were Schedule 1. There was a transmethylation theory of psychosis, which John Smythes put together, during his time in England and in Alabama, and it proposed that there was abnormal production of DMT as a result of some inborn error of metabolism. And some of the European studies are still using the so-called psychotomimetic model of psychedelics. There's a DMT study came out from Germany a few years ago, comparing the effect of DMT in normal volunteers with the effect of ketamine in normal volunteers. And, this is an example of you are going to find what you're looking for, because they gave schizophrenia questionnaires, and these normal volunteers who got a big dose of DMT responded, quite high on the positive symptom scale for schizophrenia, as compared, to ketamine, which increased scores for the negative symptoms. Um, so the theory I think has still got legs, although it isn't being studied all that much. Yeah, so they do screen out severely, mentally ill, people, for most of, the psychotherapy studies, nowadays. There were a few studies, giving psychedelics to schizophrenics in the, 50s and 60s,
Mm.
to see if it would increase, their engagement with the outside world. Were they more or less responsive, to psychedelics, indicating some tolerance or some abnormal um, uh, metabolism or sensitivity, and also to compare the symptoms of an acute psychedelic state with the symptoms of acute psychosis, because if giving LSD mimicked the hallucinations, the delusions of schizophrenia, then perhaps you could blockade the effects of LSD, and at the same time you would have some insight into using the same compound to block psychedelic symptoms in psychosis.
Mhm. Mhm. And those you said they just have not really been studied all that well yet.
No, no, not that much. Most people are still, looking at, psychotherapy as opposed, to understanding, you know, the mechanisms or the mechanics, behind the production of endogenous DMT. There's only two groups that are interested in studying naturally occurring DMT. There's a postdoc in San Diego and a graduate student in Ann Arbor, and that's pretty much it. Looking at the machinery that produces endogenous DMT, which is crazy, because concentrations of uh, uh, well well concentrations of DMT in the rodent brain are quite high. They're comparable to serotonin. So that's beginning to make people think about DMT neurotransmitter system, which would be a very strange thing to start to you know, um,
Yeah.
to think about. It would mean that there is a neuro transmitter which is stimulating in the brain the same receptors that psychedelics stimulate, and you can really start going down some rabbit holes with that one.
Yeah, 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 for sure. And you mentioned Buddhism and certain types of meditations. Were you able ever to induce those states um, with meditation, for example?
Well, not Zen meditation. That tends to be a bit sundry ultimately in the practice, and the Kensho itself is formless. Satori is content free. The Tibetan tradition is more florid, more psychedelic. And I suppose if I had been a student of that stream of Buddhism, there would have been more of a correspondence with the DMT state. Only one of our volunteers uh, had what could be described as a classic Kensho, an enlightenment experience. Everybody else, their states were full of content with which they interacted. Since there was a maintenance of their personality, so completely opposite what you would expect from an experience of Zen enlightenment anyway.